we're getting ready to get started here. So we're definitely going to have probably over 100 people tonight, which is great. Most of which should be Solea users. So I think it's important for us to be pouring into them right now because those are our people, right? Like they're very like-minded, tech-savvy people. They appreciate a CO2 for what it can do for them. And so, most of them are like that. I'm sure some other stragglers will come in, which they're welcome, obviously. But like, we're really going to try to help our fellow users tonight, just talk through some ideas about what the future holds, the best that we know, and give them some good ideas based on our markets and how we are practicing. Our practices, I'm sure, are very different and similar at the same time. And so that's the main goal tonight. So you guys just be thinking about that. I mean, we'll do these questions. You guys know we're going to be talking about some hot topics tonight, but the user base who is logging in right now, we've got 13 people. They will, I'm sure, be asking questions to us too. So we'll take some off the cuff here and really just try to help each other, really, because that's what this is about right now, is just sharing ideas, motivating one another to kind of get to the finish line here, which is just starting our practice back up. So I'm looking forward to this. Really, the huddles that we've been doing have been my favorite thing. They're not necessarily all education. We're not presenting a case or anything, but it's just about sharing ideas.
I think that's one of the things that I've enjoyed the most about being a trainer over the years is we get to spend time. I get to spend a full day with some very like-minded, very progressively minded dentists, and sharing ideas. And some of it has nothing to do with a laser, but sharing ideas and, be it marketing, be it patient communication, team ideas. And, let's face it, that not only is there a tremendous amount of fear out in the general community, but there's a lot of fear out in among our dental peers as well. What is this going to look like? How am I going to come back from this? How do I go forward? What about dental aerosols? There's a lot of scare out there, and I think it's a great time to kind of join like minds together and learn from each other and encourage each other that we're going to come back from this stronger than ever.
True.
Dr. Kelly always speaks the truth.
I mean, like, we can just stop now. I mean, we haven't started, but we can just stop. Thank you, Mike.
He's my hero.
He is.
Yeah.
He is.
You and Tony did a great job on that sleep seminar.
Oh, thank you. Thank you.
Yep. I heard a ton of good feedback. I hope to maybe see it in the future or something like that. But like, I heard a lot of people say, man, that thing is awesome. They complimented you guys profusely. So like, I hope I get a chance to see it.
Yeah, it was fun. The part of the thing was actually, I think I got mine installed February, I want to say. So I've been kind of maybe just playing with it for about a month, a little over a month. Mm-hmm. And then of course this whole COVID thing happened. So it was just like, what,
Perfect.
Yeah. And then, me, I had like 40 some patients that I already kind of did on stuff. So I was hoping to see more, and it was really picking up. I mean, people are actually calling and be like, wait, I heard from workplace and whatever. So it's been actually quite exciting and fun.
Are you already doing OATs and stuff? I mean, were you already doing that?
Yeah, so I was doing some the OSAs and all that stuff already. Mostly oral appliance, if anything. Obviously, I work with the sleep doctors just to make sure that we get their prescription going and all that. But I figured, if anything, it's a good adjunct to what I'm already doing. And then for some people, it's going to be kind of a leading into it. But the whole thing, obviously, before we even did the whole presentation, was like, this is not OSA treatment, So I think it's something that kind of really opens up to different things, just like any other Solea procedures that I feel like that we've been kind of doing. I mean, when I first got it, I was just thinking, oh, like it's just going to do class 1 through 6, anesthesia free. That's great. And then just kind of looking back and seeing where I am and what I'm doing, I'm like, gosh, these are the things I never thought I'd be actually even doing or even imagined doing. So that's been obviously pretty exciting. And that's kind of what I tell the people that I talk to a lot of times or train, or it's like, I'm like, you don't even know like what you're actually getting into until you actually get into it and know what it's actually capable of doing. Because
I
it's
mean,
like,
those of us that have been using this for years, what blows me away is I can't think of another piece of technology that I've been
yeah,
using for 6 years that still surprises me on something I can do with it on almost a weekly basis. I do something and go, I never even thought I would use it for that, but it made my life easier. It made my life simpler. And
right. And then so some of the things, the cases that come in, it a lot of times it would be like, it kind of makes you kind of cringe. But now you look at it, you're like, no big deal. We can kind of start to take care of this. And you kind of makes you really treatment plan in a different mindset as well too, which makes it very exciting. And it also kind of rubs it off on your team. So a lot of times my team kind of tees up everything for me before I even walk into I kind of train them like a resident. So they have to give me the whole soap things, and then they have to have all the differential diagnosis for me before I walk in and have all the possible treatment plan that I'm going to do ready. So a lot of times for them, instead of coming in as like, "Ooh, I think that's a goner, Dr. Kim," they're like, "You know what? I think this is something that we've done before. And like, I know you've done this, and I think we can do this with Solea." And so their mindset is also changing as well too, which is really cool.
nice.
Yeah, that the excitement is definitely an infectious aspect, both with the team, and once your team kind of gets it, it just flows onto the patients. And I think that's what has been so cool for me. And just like you said, Mike, how it just constantly builds. And there aren't many things in technology that we use day to day that it's the same piece of technology that just keeps getting reinvented, where everything else is a hardware software upgrade that you got to basically redo the whole machine. So it's been a lot of fun to see where people initially intend to use it and where it actually ends up becoming their passion. And where that passion goes is just, who knows where it's going to go from here. But the snoring and the sleep side is definitely going to open up another door for more utilization of something that we've already been using just for filling. So it's
kind of like having a whole nother laser. Like, wow,
It is.
like Dr. Kelly mentioned, like every week goes by or every quarter goes by, there's a new update, and it's like you have a brand new machine. I wonder, Dr. Kelly, how many of your old lasers you have do you feel the same way about?
0.
The funniest thing, my team, as they're watching some of these sleep things that I'm doing, they're like, "Dr. Kim, you think you can work on right there?" Right there. And so I'm like, I don't know. Maybe we're going to be working on some wrinkle therapy too, So off the record, but.
Well, Tim, to your point about the team, and Yusan, you were saying the same thing, but when the team is on board with this, let's face it, we carry a lot of clout in the office, but what your team discusses with a patient before you walk in a room is honestly more important than what you even talk about.
Oh,
Because
absolutely.
when the team believes in something, the patients buy into that so much faster.
Right.
And when I walk into a room and the team's already kind of got the patient's soul, they've educated them about their broken tooth and they're going to need a crown. I don't need to do anything. Just walk in and just go, okay, she told me what's going on, and the patient's like, yeah, I'm going to need a crown, aren't I? And it's because it's coming. I think they just buy into it so much easier when it comes from the team. So that's one of the things I do love about Solea is it does really empower the teams and really excites them, and they stay like that.
Yeah.
Well, it totally builds off just a culture. I mean, and that culture stems from us as the clinicians, but ultimately that culture is what transcends to our team, which then goes to our patients, which attracts more patients that value that, and which has made it a lot of fun for me. You were talking about how you get to train all these users. So, anytime I go into an office, it's so much fun to see how different everybody does things.
Yep.
Yet
You learn from each other.
Oh, absolutely.
Yeah,
but that core passion is still there with everybody. And I think that's what unites this really cool group of users that value not only how and what we do, but the value that, looking at the bigger picture of that it's more than just a filling without anesthetic, or it's more than just a cool piece of technology allows me to do something I couldn't do. It's it's the culture of people and clinicians. And I think that's why I get excited when Heath has this, cool concept of stuff like this, where we start bringing like-minded people together, and you start looking at the people within the community, even already online, that it just starts building this culture, which is so much fun to be a part of.
Totally agree. Totally agree. I actually had a couple of my employees who have left the practice because they were moving or, life changes and whatnot. They actually recently rejoined because they're like, I can't find any practice that's as fun as, working with Dr. Kim. But mostly it's because of technology. I mean, it's a Solea. They just couldn't fathom not being able to do certain procedures because they didn't have the technology. That's literally what one of my assistants said. I'm like, Dr. Kim, I have to bite my tongue because I know what this can be done and how this should be treated, but they just don't have the technology, and I just can't do that. So again, they know it, especially those good team members who know what it is and who already were trained and bought into the whole thing. I think it makes it exciting when you see something like that.
So we're about to get started here. A few people trickling in. A couple shout outs real quickly. The Golnick Pediatric Dentistry Group, okay? You remember them, Mike Kelly? 4 years ago. They're from Michigan, and they wanted to say hello. I'm not sure. Are you guys seeing the web chat at all?
I have it open on mine so I can see them come through, and Steve Boardman's on. And
yeah, good. Yeah. You have the question answer module too?
Yeah.
I don't have that one open. Let me see.
So one of the questions, we'll go ahead and do it in the pregame here, is Dr. Kim's with us. She did one of the sleep seminars already. Will that be talked about again in the future, Dr. Kim?
I think there's a chance that we're doing that again. We were just talking about that today because there are a lot of interest there, and then a lot of people actually wanted to watch it again or being able to participate again. So there's a talk on that probably toward the end of this month, I think we were thinking. But if there's enough demand, then we may actually start to push that up as well.
Great. That sounds good. I know that's a hot topic. All right. So it's 8:02. I'll go ahead and get started with our intro. I think most people are in at this point. Real quick, Window Learning Center bringing you this tonight. I want to go over the ground rules for a Zoom meeting real quickly. There is a webinar chat feature, which that's awesome. That's a lot of just camaraderie going on in that group. Feel free to just chat about things, ask questions amongst yourselves, but we will not necessarily be monitoring that. The main thing we'll be monitoring is the question and answer module, which is different. So if you have a real question that you want answered live, just ask the question there, and we'll do our best to get to that while we're here. If we can't get to it for some reason because we're overwhelmed by questions, we will write everything down, and we'll try to get to you after the show here. Real quickly, I want to introduce myself. I'm Dr. Brantley. I work in North Carolina. I've been using Solea for close to 3 years now, and I train for Convergent Dental. That's about as much as I want to talk about myself. I'm going to go round the clock here. So the next person clockwise to me on my screen is Dr. Anderson. So I'm going to go ahead and let him introduce himself.
Hey guys, Tim Anderson. I'm out of Bismarck, North Dakota, where it's a lot colder than the rest of the panelists here. So it was like snowed here yesterday, and is really good for the whole shelter in place thing. But I have a private practice. It's I just had an associate this last year, and now we're currently building a new facility. And part of that is the integration that we had with Solea. I added Solea to my practice about 3 years ago. So Dr. Kelly here actually was my trainer and a big, mentor of mine, getting me on this track, and makes me excited to be here with you guys to kind of, just talk shop with like-minded people. Like, these are my favorite people in the world to talk with. This community is my favorite aspect of dentistry, and is really what motivates me to deal with the crazy ass people we deal with on a daily basis. So it's what keeps me sound. But also, even during this time, we're all struggling together. And I think this offers a unique opportunity for us to come together as a community and talk about stuff that's real to all of us. So we all know we're not alone. One of the things we've all invested in is this technology, and I think that's going to help us move forward quicker than maybe the rest of our community. So it gets me excited to be here. So excited to hear everybody else and where this goes tonight.
Great. So next up, clockwise, is Dr. Kelly.
Sure. Michael Kelly out of Scottsdale, Arizona. I'm a private practitioner as well. I've been a Solea user for 6 years now. It doesn't seem possible, but 6 years. Time flies when you're having a lot of fun, and this technology definitely does make my life fun. But as Tim and I were chatting about earlier, I think the best part of this has been the camaraderie of other like-minded, forward-thinking dentists that really care about our patients, care about dental excellence, really want to leverage this technology as much as possible. But I think it's been a great group to really lean on each other and push each other and encourage each other. And times like this really make. As we were talking before the seminar, there's a lot of fear out there in the general populace, but there's also a lot of fear within dentistry. And I think it's important that we take these opportunities to discuss and learn from each other and find out what's working and what's not working, and some just kind of have some times about what are we doing and how can we move forward out of this.
Good. And next is Dr. Yusan Kim.
Hey, how are you, everybody? So I wanted to share a little funny story because, as Tim was saying, Michael Kelly was also my trainer as well too, and I actually totally forgot about it. And he reminded me in one of the meetings that the actual training date that I was supposed to be trained by him, the night before, I apparently called him to cancel the whole training because I'm like, it's not gonna work. My team's not on board, and we're not gonna do this, and which was true actually, but I forgot about that, and he reminded me, and I look back and think, wow, that was a pivotal moment of the career change in a way for me, and how thankful I was that he convinced me that I'm still coming, you're going to do this. And at the end of it, if you don't want it, then just be it, type of thing. And I think at the end, and the only thing Dr. Kelly remembered was how much food that we ate at the office throughout the day. So
I was going to say,
right?
Your team still holds the record for eating the most of any team I have ever seen in all of my career.
Gotta feed them, gotta make them happy.
Constant. It's, like constant grazing all day.
Hey, like if I'm actually running 100 patients a day, gotta feed them, right? Gotta make them work. I gotta feed them well. So anyway, I've been, so since the end of 2015, I've been using Solea, and it's been amazing. And I think some of you probably already know that. Going from that one Solea, we were just talking about that earlier. I initially got it thinking, oh, it's gonna just do, cavity prep 1 through 6 without anesthesia. So that was kind of my expectations. And it, of course, went above and beyond, as you all know. I mean, the amount of stuff that I'm doing, amount of things that I can do, and the flexibility, what I am able to do, opening the mind for the more of a comprehensive treatment they can bring in for your patients and for yourself, make you a better dentist as a whole, too, because it really makes you think differently when you're seeing a case of where it needs to be and how it needs to be. Also makes you think outside of the box as well, too, because you kind of think, if this is able to do this, wow, this got to be able to do that. And then it just kind of opens everything up. And I think this is what makes our Solea users all unique, because we're actually adding the repertoire of what Solea is able to do from where it was 5-6 years ago to where things are now. And also the possibilities for me is endless going up, especially with all these sleep modules and everything else that's getting added to it. I think it's amazing where it's heading towards. So I wanted to thank everybody on the panel, especially Dr. Kelly, obviously. He's the grandfather of it all.
He is like the grandpa here. Yeah, the OG. Yeah.
He's a Jedi master.
Yes.
Yoda of us all.
Yeah.
I did find that if you put Pinot Noir in a Hydro Flask, it's a lot more PC on a business level.
What do you guys think about this little fun glass?
I like that.
Is it a microgreen or something else? So real quick, I want to get this out of the way. When is the snore course planned? I think, to my understanding, is to be determined. I think they were really trying to launch it at user group. And so because that's been postponed, they are probably going to announce something as a replacement option. I don't know if you guys know anything else about that.
The most recent news we got was that user group meeting being canceled. So I'm sure there's going to be something out there as well too.
Okay.
So as far as being able to use it, it's pretty easy. So I don't think that's going to be an issue, but having understanding of the whole screening and the snore process and also kind of relation to the OSA, I think that's something
Right.
that we can dig into further.
Yeah, for sure.
User.
So a fun icebreaker here, let's say 30 seconds or less. We're going to go around the table here. Where do you see dentistry in 6 months from now? Just quick hitter. Don't elaborate too much. 30 seconds or less. Tim, you go first.
I think contrary to a lot of people's freaking out, I think I focus on what I can control in life. And I think in this situation, I'm very optimistic of where my practice and where the Solea users are going to end up on the backside of this issue in 6 months. And part of it really ties down to the fact that we have a culture surrounded around our practice and patients that value what we do. Most of us are not attracting patients because we are the in-network lowest cost provider. Most of our patients come to us because of the quality and the services that we provide. And so for me, my services are going to be there. The question I have is, how am I going to reach that demand when all these patients now who haven't been going to a dentist, haven't been getting the restorative work, and now need crowns or endo, that may not be able to get into their old dentist? How am I going to be able to work them and welcome them into my practice once this is on the flip side? So that's kind of the outlook I'm taking. What I'm planning for is, how can we hit the ground running and actually anticipate an influx? But that's partially due to North Dakota. I think a lot of the people in North Dakota, because our numbers are low, are ready to get back to reality. And so I think I come from a little bit different perspective than some of you on the coast. So I'm excited for 6 months from now.
All right, that was more than 30 seconds.
I know, I'm sorry.
You've earned it, sir. Dr. Kelly.
I'd have to just echo Tim. I even though we're in a different demographic, Tim, I think we're going to see the same thing. I expect that we're going to be busier than we were before all of this started. I do think that there is going to be, I think there's going to be some lingering PTSD on patients' behalf after this. Patients are going to be a lot more savvy. They're going to be a lot more aware of infection control practices within offices. The good thing is most people that invest in this kind of technology are already doing the things that we should do. And as we've advised patients, look, we're used to treating everybody like they're infectious. That's something that we always do. But there are some things that we can do, and we'll talk more about this later, but there's some things that we can do to set their minds at ease. One of the big concerns has been aerosols. Well, what do we do with that? And again, that'll be a good topic to discuss, later. But I think we're going to be, busy still playing catch up from all the time we've had off.
For the record, he went more than 30 seconds too.
Yes, I know.
Now the pressure's on. I'm going to actually stick to
it. You're the time queen, so let's go.
Yeah.
For me, I actually think transformative is the word that comes to my mind, because we were already in the mode, like especially as a Solea users, we know what that means to be transformative in your practice. This is an opportunity. This is not a time to be scared of. Yes, we're in a survival mode right now, but we're actually getting into the mode of resetting ourselves as well too. Whatever the new norm is going to be, whatever it's going to be different, but it's going to be different excitingly. And I think that's going to be the most interesting part that we're about to see. 30 seconds?
That was 30 seconds.
That was good.
That was pretty good. So, well, I'm going to play devil's advocate. I mean, I'm naturally an optimist like you guys are. That's why I invested in Solea with a hope and a dream, right? And it worked out. But let me just give maybe another narrative, just for the sake of the people here that are not optimistic. I think we do need to be realistic. So I am definitely hoping for the best. I agree with everything you guys said, but I am preparing for a less than stellar boom, if you will. So kind of, if I were to just very summarize this, I would say if at June, which is early, we'd be at 25%. I think at October, we'd be at 50%. And then I would say probably by like January, we're mostly past all of this. And then maybe I'm back at 100%. Do you see what I'm saying? So I think it may not just, we're not going to pick up in February of 2020. That is gone. But like you said, we have the ability, we have the technology, we have the mindset more than anything to get back to normal. So I do think that Solea dentists are positioned to be able to do this better than, say, the average dentist that has less resources or less flexibility with the practice set that they have. I'm going over 30 seconds, so I'm going to shut it off. So poll number 1, I'm going to launch a poll real quick. I want to know who is an actual Solea user right now, and I want to know who is maybe a salesperson and who is maybe just curious about Solea and they got on this call somehow. So keep trickling in. This is like election night. Okay, it's changing like crazy. At least 80% have at least one Solea. That's kind of what I was thinking. There's a couple salespeople on here, and there's at least 5% that are selling Solea. So keep going, because there's only 65% of you that voted. I'm going to give you 15 seconds. Come on. We want to know our audience here before we continue talking.
Just to kind of piggyback to what you were saying, Heath, getting prepared to be open on that one Monday that we're going to be back to work. We are going to make sure that we are getting prepared for that. And that would be how you're positioning your team and how you're preparing yourselves and kind of crafting your schedule, crafting things so you can actually make sure that you're maximizing what you have available as well too. My biggest concern is PPEs. I'm like, am I going to have stuff that I need in order to? So, you know, right now I have donated a lot to local hospitals and whatnot. And then I'm also trying to make sure that we're going to have enough for what we have to do. And then I'm sure we're going to have different OSHA regulations, and I'm sure we're going to have different, guidelines of where things are going to be.
Right.
But I want to make sure that my team feels safe, I feel safe, and my patients feel safe coming into and getting stuff done. But there are a lot of things that I think we can do, and we can, of course, discuss that. I'm happy to share all my ideas as well, too, to be ready, not to have that curve to be so slow and painful, so we can hit the ground and go.
Right. So we got the results of the poll, and it's kind of what I thought it would be. It's at least 80% have Solea tonight, which is super helpful to know. That's what this is about. It's called a Solea Huddle. So it's like people who have Solea or know about it at least talking. There are a few people, though, that are interested in Solea. So, you guys take what we're saying and just think about maybe implementing it yourself in the future. But I'm going to move forward and talk about the first hot topic, which is aerosols. I think this is a big enough topic to where we could probably all spend at least 1 minute talking about it. So I'm going to again start with Dr. Anderson, let him talk for a minute. Hopefully he won't abuse his time. And we'll move to Dr. Kelly and Dr. Kim. And we'll just talk real briefly about aerosols. What do we know? What don't we know? Just general thoughts about it.
I think I'm going to take a little bit to the devil's advocate, because I know there's been a lot of talk recently about how Solea may be safer than a handpiece or drill. And, I kind of take a step back from this whole aerosolization concept in the standpoint of breaking down into two aspects of one, what does the research say? And there isn't a ton of research on, Solea with aerosolization in comparison to other aspects. But the bigger important thing for me is that you guys, we're dentists. We work in the oral cavity, you know, and so aerosolization of a virus really isn't anything new from a precaution that we shouldn't have already been taking in the first place. Whether it's TB, hepatitis, herpes, HIV, any of these other bugs that can get aerosolized should always be on our radar. And I think this new pandemic has brought it to light a little bit more, but I don't want people losing their mind moving forward in the future. And if you really, and I think I'm gonna struggle more with this with my team and the standpoint of hygienists being really concerned about aerosolization and all that, but that's, you know, we are in the oral health profession. And if we're not comfortable with certain risks and trying to reduce those risks, but we can't eliminate the risks. You know, we don't work in negative pressure biohazard suits. So I think there's going to be this balance of getting over the hump. I think, you know, for those that were practicing in the, you know, 80s and the HIV epidemic and all that stuff, saw a lot of changes there. I think once we get over this hump, it'll mellow out. But I think it brings up the important aspect when we're talking about herpetic lesions and any lesion, what are we actually doing? And so I personally, this doesn't change a lot of my protocol. I'm a little bit more cautious currently with the current pandemic, but really I treat it like I do any other virus and potential TB patient. I think good quality screening is going to be key, but I don't think we need to go crazy, you know, with the aerosolization aspect. But like I said, I come from a little different perspective there. So I'm curious to hear what the rest of the panel has to say.
All right, Dr. Kelly, 2 minutes later, it's your turn.
Damn.
You know, Tim, I actually agree with you. I think that we're used to this stuff. The only reason I brought it up earlier is because there was a thread right after all this stuff hit saying, well, I'm putting my Solea in a closet. And I'm like, well, that's crazy. You know, if you're going to do that, put all your hand pieces in the closet, put your ultrasonic in the closet. We are dental health professionals, and we need to figure out how to safely move forward. I think one of the best pieces of advice I saw was consider, you know, good health screening is great. What about oral rinses that you know, help reduce that bioburden that's out there? So something as simple as a peroxide rinse or Peroxyl or any other antimicrobial agent to reduce the aerosols. I think we need to look at, you know, possibly some air scrubbing in the office if you're concerned about lingering things. But other than that, we need to be practical and move forward.
Nice. That was pretty close, Dr. Kelly. Thank you. Yusan.
I'm going to just say off the bat, I'm probably going to be more than 2 minutes. So, because I want to share with you of some of the things that I'm doing from my office. And for whatever the 2 cents, if it's something that makes sense to you guys, obviously, I want you to think about all these things as well, too. So the big thing, obviously, is our world is spit and aerosol. There's no doubt. We're not going to be getting away from it. And Dr. Anderson is absolutely right in a way that, yes, universal precaution, no matter what, HIV, Hep B, whatever Hep C it's going to be, we're always going to be exposed to that type of environment. But having said that, COVID is a complete different way. And we're right in the area where all the respiratory stuff is happening right there as well, too. So we're actually at the higher risk. And I think we know that because the New York Times came out with dentists being the highest risk, you know, for infection and also transmitting as well, too.
Yeah.
So when it comes down to aerosol, I do think Solea, theoretically, is going to be better in terms of reducing the aerosol for us. Because I think the amount of amount of the water that's going to be outputting, we're looking at about 10 to 12 mil instead of like a 30 to 60 plus mil that we're going to be outputting with a handpiece.
Yeah.
The way that it's going to be passively delivered to the site that we're actually prepping is going to be a lot gentler as well too, rather than a handpiece that's rotating at the same time, creating the centrifugal force of water just spreading everywhere as well. That's also going to be something that's going to creating not just the aerosol, but just the environment that's going to be dirtier, and also having that means of having the COVID or any type of virus that's going to be transferred with on the droplet size of things. So having that controlled misting of this Solea and having that passive suction, I think that's going to help with the aerosolization as well too, or less of aerosolization. And I think another part that I was thinking is that not only just where you're working at, but it's going to be the overall air, because aerosol just does not stay where you are. It actually gets spread out, and it's going to be permeating into the rest of your office as well too. So when I'm actually thinking about decreasing the aerosol, I'm actually thinking the whole office. So I actually looked at some of those, the HEPA filters and some type of the air purification systems and whatnot. So there are some opportunistic things that are coming out. There are some of the things that were already present that's out there that's now actually advertising heavily. So one of the ones that I looked at was through ADS. It was called, I think it's literally called the extra oral vacuum system or suction system or something like that. It looks like a giant vacuum that you put it right over the patient's mouth as you're working on it. It's like having a giant vacuum there that's suctioning off stuff. The critical part of that one actually was the special filter of the particulate size that it was going to filter through. So the smallest filtrate that it was going to filter through was about 0.3 microns, whereas obviously COVID is less than 0.1. So we wanted to make sure that that is also filtering through properly. So that was that one. And then I think another part of it is that you need to make sure that whatever the filtrate that it's going through and whatever the filtration there is, it's not just the claim of the HEPA filter that's going to be working. It's the matter of the particulate that's actually going to be filtered through properly. So it's the high ultra filtration that you have to look for as well too. So the other one that we looked at was IQ Air. That was another one they looked at. That's been around. It's a Swiss brand. It's pretty good, but again, it doesn't go through the four stages of the filtration that you have to look for the air purification. So the item that I looked at, and then I actually ended up getting from my office, which I'm on a wait list for because everybody else is getting on the list too, is something called the Surgically Clean Airs. It's a Canadian brand. It's actually pretty big system. So the one system is called the Cascade. It's about 5 feet tall, and it's a pretty good size. It's actually nice looking white color brand that you can actually sit at. I think the 1 unit of a Cascade can filtrate the whole office air every 30 minutes up to about 2,000 square foot. So I ended up getting 2 for one of my main offices and then getting 1 for each of my satellite offices. They also have a littler unit called the Jade, and that is more for if you have like a hygiene room or something like, or a surgical room where you're going to really worry about making sure that air filtration is going to be important, keeping that aerosol down. Those are going to be the good item to have as well too. So I'm recommending for all of us who are in this panel, and also for the people who are listening, if you're thinking about these type of things, to look at those units. If you do your own research as well too, but I mean, I did it. So if you want to take my word for it, you can certainly look at that as well too. But I think those are going to be the important things for you to have. And I don't want it to be a gimmick. I don't want it to be an emotional, fear-driven purchase that you're making. But I want to make sure that it is something that you know it works and scientifically it's backing it up and why it's doing it. So you can actually make sure that you're creating the environment that's safe for you, for your patients, and for everybody else, your staff as well too, because I want my team to feel comfortable coming back, knowing that everything is going to be nice and safe for them as much as I can. And it's something obviously that's going to create an internal marketing for yourself as well too, because I'm going to put that on my website. I'm going to say that what it is, and patients are going to ask, and I'm actually having a script that's going to be ready for my team to be able to say, when patients ask, what are you doing differently? And as Dr. Kelly was saying earlier, patients are going to be savvier. They're going to notice things. They want to know what you're doing differently. So just by saying we're, compliant to universal precaution, it may not cut it at this point, because things are a little different and everybody's a little more cautious on this as well too. So that's my 2 cents on the whole aerosol situation.
I think those guys with the SMART technique were just leaps and bounds ahead of us on this curve.
Yeah.
You guys familiar with that?
No, I don't know much about that.
Oh, it's popular with a lot of the holistic dentistry. It's the safe mercury amalgam removal technique.
Yeah,
but
the ADS was initially.
Yeah, it uses that suction thing and full barriers and rubber dams. So
well, we'll have to talk to our boy Daniel about that. He's on here. Okay. He's one of my trainees, and he taught me a lot about that stuff during training. Dr. Kim, you're right. That was way more than 2 minutes.
I'm sorry, but I wanted to share because I knew that.
It was very good information. You were not censored, so don't worry about it. I'll take less than 2 minutes because Dr. Kim took part of my time.
Oh my! All right.
I'm just kidding. But I do agree with Dr. Kelly's sentiment that dentistry will change, kind of like every 7 to 15 years. Something happens that fundamentally changes dentistry. So 2008 happened. That fundamentally changed dentistry. 2020 is happening right now. We're going to see how it changes dentistry, but right now we're just speculating, right? But in general, I do agree with the sentiments here that there are a lot of relatively low cost things we can do to prepare ourselves for what's changing. I mean, I don't think we need to go invest $20,000 per operatory right now. I do think there's some very low budget things we can do to give our staff the confidence they need to come back to work as one person intimated here today. So one other thing I want to mention is we are going to have an aerosol CE that we give on April 20th, 420. So why not talk about respiratory health on 420? So we are going to talk about a lot of different aerosol concepts. A lot of this stuff has been covered in the past. It's just basic precautions for people. But we're also going to layer in how is COVID-19 questioning some of this stuff and what should we layer into our universal precautions. So that's coming up just to let you guys know about it, April 20th. A lot of the stuff we've already talked about here will be covered, but some more stuff too. I'm going to move on to the next question.
Hey, Heath, can I just add something real quickly?
Sure.
There's been some question on aerosolization, and basically what they're saying is, use of rubber dam, use of extra isolation, so things like isolite. Does that help? And I believe it does. So many of us are already utilizing some of those things to help keep down our exposure and other patients' exposure to that. So I think that it was worth mentioning. It was a great question.
Yeah.
And one more thing that we can do.
Yeah. So real quickly, to just give you a sneak preview, what's been proven time and time again is that rubber dam in conjunction with an HVE, you have to use the HVE. That's critical, not the saliva ejector. The HVE 8 mm wide opening, that removes at least 90 or more % of any aerosols leaving the area. And again, when you're with a rubber dam, you're only looking at a tooth or a few teeth at a time. So you're not actually like looking at like the tongue and the pharynx and all that. So just keep in mind like that there are some things that are already in place that are protecting us. So we don't need to lose our minds quite yet about it. But 90+% is being removed if you use an HVE. There's also research that says if you use like dry shields and isolites and similar type things, that is also removing 90%. And it's not as dependent upon the HVE. So I can only assume that if you add an HVE to the situation, it only gets better, right? So yeah, so we're going to talk about that April 20th. I kind of want to move on, but that's a good point. I'm glad we had that comment because basic standard practices are still at play. We can't forget about the basics and then add in extra stuff later. All right, so an interesting question we have here is what do we expect patient flow to look like when we come back? And if it's low, as many expect, how can we use Solea to help get our practices back up to speed? Tim,
Ooh,
1 minute.
1 minute. I'll keep this kind of short just because we covered kind of a lot of this when we were asking where things are going in the future. But, one of the things that has always made the Solea community kind of a step ahead of the rest of our colleagues is our scope of practice. And so I do agree, we're going to have this like PTSD of like some patients are going to be like, I need to just wait on this stuff. And I'm okay with that, especially on a lot of our hygiene patients, but we're also going to have a lot of restorative and other procedures that, depending on what your scope is, a traditional drill and fill dentist is going to be much more limited, where if we as Solea users have a much broader scope, whether that's airway or, soft tissue surgeries or hard, whatever it might be, we have so many more buckets that we can dip into to help alleviate that slow volume that may occur. And for me, that's very reassuring because, you know, one of the things I saw with Solea initially was that my practice production and my, you know, my profitability went a lot higher, not necessarily because I was seeing more patients a day. It's because I was doing things that were more profitable. And those types of services are going to continue to kind of move us forward. So in this interim time, I think it's very important to continue emphasizing CE and advancing your career and advancing your education base and your knowledge base. So that way, when this ends, jump in and do it. You know, it kills me. You know, I joke because Yusan, I know you said you haven't done a root canal since dental school. Root canals right now are like the best thing ever because that's what's driving a lot of my practice. Yeah. So it's just showing a scope thing that allows us to do more. So, you know, by not limiting what we can do, it makes me a lot more reassured that even with slower volume, we're going to be fine. I went a little bit over, but I was better.
Yeah, it's pretty good. All right, Dr. Kelly.
You know, I think one of the things that Solea has always really shined at is allowing us to do more dentistry in the same amount of time and take on really challenging cases and then make them simpler and make them no big deal. And I expect that, you know, we are very well poised to go forward into this, maximizing the time that we do have. So if the patient volume is less, it allows me to deliver care very efficiently to as many patients as I can see, do more dentistry on the patients that allow it. So, you know, I think that we're already doing that. We're used to doing that. So I don't really see that being any different.
Okay. Pretty solid. That was definitely under a minute. Thank you, Dr. Kelly.
You're welcome.
I think both of the panelists already have answered the question, so I'll be pretty much repeating them as well and echoing them, if anything. I think if anybody, I can probably attest to how much of a production increase that I have seen with Solea. And again, as Dr. Anderson was saying, it's not so much because I was doing more. Of course, I am doing more too, but also it's because it's increasing the depth and the breadth of what you're doing as well. That in itself is not just because, you know, it gives me an option not to having to do the root canal. Like it would be the worst thing, I think, as a clinician, if you have to do something because you're feeling like you have to do it because you don't want to lose that production. That would be like the last thing I want to do. I want to do what I want to do. I want to love what I do. So in order to be able to do stuff like that, and then being able to have that depth and the plethora of the things that you can do in dentistry, Solea makes it possible. So I think Dr. Kelly's absolutely right in that we have poised ourselves with Solea and the technology that you have in your practice to be able to kind of get yourself ready and pivot yourself to where you are in order to make that the next change of the reset.
Pretty solid. That was 1:06.
Oof.
Right on the point.
All right.
I'll take it based on Dr. Anderson's comments. I'm just
going to start timing myself here.
No,
he goes first. He sets the ground.
Y'all are doing great. Y'all really are. So I'm not going to say much else on that question because I want to get to other questions here. So how do we best communicate with our patients during this post-COVID-19 situation? What should our message be exactly? Dr. Anderson.
Man, see, we got to start going the other way. That way I can feel like I just agree with what everybody else says. No, you know, I think the message, whether it's our patients, our team, our family, our community, I think it needs to be relatively the same for all of them. And the fact that, you know, our patients need to know we're here for them. And I think throughout this process, that's the big thing that I've noticed. And we were joking earlier, Dr. Kelly was talking about how he's had patients call him to tell them that they have an issue that's not an emergency. They just want to tell him. And what that really is emphasizing is the community that he's built around his practice, that people sometimes just want to be heard. You know, they just want to be reassured to know that we're going to get through this. We're going to be okay. Our team needs to know that we as clinicians feel good about it, and they will build off that confidence. And it just kind of trickles down to our patients. But the hard part, on a little tangent, I'm going to go over a minute here because I want to bring it up, because I think there's also this thing. See, I would have been done, so it was good. what I want to
I
bring
love
up,
how you
though,
knew it was a minute.
I know, right?
Why?
What I want to bring up too, though, is I think it's important for us to make sure people realize that dentists right now don't get a lot of sympathy within our community. And I don't know if you guys have seen that. I have neighbors that, I tell them, hey, I'm not working on it. And their immediate reaction is like, oh, well, you're a dentist, you're going to be fine, And so there's this misconception that a lot of our community, our patients and our team members don't realize the burden of running a business, and that we are very similar to the restaurants and other things. We have a very profitable business, but our overheads are usually a lot bigger than they have. And so there's a lot of stress that a lot of us owners have that I think is important, that whole sympathy is kind of lost. And so I think it's very important for us as the leaders to come out strong, but I think it's important that we as leaders stick together, because it's okay to admit that right now is scary for us, because it is. I mean, there's so many decisions that we have to make right now that we're making with very little education, without knowing what's going to happen, but everybody's looking to us. And so that's why I think the community aspect is really important. That was a total tangent, but I think it's really important.
It's great. It was worth 2 minutes and 30 seconds. Thank you.
So, Tim, what I liked you said on that was that as leaders, we kind of set the tone in our office. And, I saw this. Arizona was a little late shutting things down, later shutting things down than other places. So we were open for about a solid week while most of the rest of the offices were closed. And during that time, the team really looked to me for leadership. How nervous should we be? And they fed off the confidence that we had of like, look, we are used to treating patients like they're infectious. Don't do anything different. The only thing we did different was made it very visible when we were washing our hands, and made a spectacle of it, offered the patients the opportunity to do the same thing.
Yeah,
So
emphasized it. Yeah.
what we're planning on doing when we go back is to do just that, to continue using proper infection control, to focus on preventative health and general health of patients. So one of the things we've started offering is some of the supplements that we use to keep our immune systems healthy, to keep their mouths healthy, so that they don't, tax their immune system with things that are controllable, to focus on that. And I think that's really what we're going to be doing going forward.
Solid.
I obviously echo everybody's sentiment as well too. The one thing that I actually see this change of what we're doing is actually an opportunity for us to really position ourselves to be the oral health physicians. We're not just dentists. We're not just associated. I think I heard that in some of the webinars that I was at. We're not just the professions that are technicians with the drill and burr and fixing cavities. We actually are in a position where we can actually position ourselves to become that oral health physician. I think a lot of my patients actually see us as a primary physician because we see them more often than their regular physicians that they see. So we've always kind of had that approach, but I think this is a good approach for all of us to have. I think I'm echoing Dr. Kelly saying that yes, preventive care is important, and how it's important in relation to the systemic health. I mean, it's just all linked together. And I think this is just a perfect example for us to be able to position ourselves to know that yes, we are actually oral physicians that is caring for the overall health of everybody. And then now we have means to actually provide those cares and then be able to address that as well too.
I think that's such a great response to that, Yusan, because this is going to be such an amazing opportunity, and we will look back on it, and our team's going to look back on it in our community and how we react to all of this. But I think that tie between the medical side and the oral health side that has often been kind of separated, this is an opportunity for dentists to step up and act like the clinicians and physicians that they are. But that's going to require the clinicians to step up, like get educated, know what's going on, be a part of the community. Don't just abandon everybody and only see just emergencies and push everybody to the endodontist or oral surgeon. It leaves us to an opportunity that I get really excited about to see where this goes from here, and how we as a dental profession will be seen by our medical colleagues as well as the community. So I couldn't echo what you said stronger.
Bonus time for Dr. Anderson. So I agree with everything, obviously, but like you said, we obviously are physicians of the mouth. We're dealing with infectious disease that starts in the mouth, apparently, and also the nose, and that's where we're working all the time. So respiratory health is a huge thing for dentists, and we should start thinking about that. I think we've done a good job in years past of being a safe place for the public. People do not generally think they're going to catch the flu or infectious disease at our offices, whereas they do think they will catch those things at a hospital, right? So we have been commanding the trust of the public, and we have taken that for granted to some extent, right? Because right now, I just want to introduce a couple quick ideas of what we have to be on guard against. I'm not saying it's going to happen, but we did effectively shut down pretty rampantly, and there's a couple messages that I'm afraid the general public has heard. Number one, I think that they have heard that the dental office is not safe, right? Because we basically said, stay away from here. We can't guarantee your safety. I'm not saying that was the wrong decision. Relative to a pandemic, you can put off a cleaning. You see what I'm saying? It's all about being relative, right? That's what we teach in basic training, and Solea is relative to the old school of dentistry. Solea dentistry is way better, right? It's all about relativity, right? But does anybody just choose to get a Solea filling instead of going to get their toes manicured or pedicured or whatever it's called? No, because relative to something, the relativity matters. So what I'm trying to say here is we have to be careful, because the general public is not going to feel safe after this. We may feel safe, but the general public does not. And we are going to have to overcome that. I'm not going to get into that whole discussion tonight. The other thing is team. We mentioned the team being safe. That is where we play probably the biggest role, is being the leader of the practice. We have to make our team feel safe, because if they don't feel safe, they're not going to come to work, or they're going to project their unsafety onto the patients, which is obviously not good either. The third thing that I think we have to be on guard against is this idea that oral health was not important. And again, that goes back to the idea that relative to a pandemic, yes, a lot of things are not important. So we postpone a cleaning for 4 weeks or 6 weeks or 3 months, whatever it is. But again, we are the clinician. We understand that their cleaning is important. We're not just putting it off for the sake of putting it off because there's a basketball game or something going on. We put it off because it was a pandemic raging. Do you see what I'm saying? So we have to reinstill that oral health is important, because think about it. We've had some people we've been preaching to for years that every 3 months was super important, right? Like your perio has to be treated every 3 months, or like basically you're going to die. Like that's kind of the message we've been preaching to them. And then all of a sudden we were like, well, never mind. Like you can go away for 3 months, as if it was like that's just how it is. And again, it's relative to the pandemic. The pandemic changes everything temporarily. But after the pandemic, I think those are 3 things we have to watch out for: the general health that the patients feel when they are in our office, the staff safety and all that, and then whether or not oral health is actually important. We may have to rebuild some of those things, right? I came into practice where all that stuff was kind of understood. Like it's safe to go to the dentist, oral health is important, team members show up to work because it's safe. I am a little worried that when we go back to work, I'm going to have to struggle with those 3 things.
Can I have extra?
Yes, extra time.
You took over 3 minutes, and that was a minute and a half after I started timing. So
You're not supposed to
take all the
time you want.
I am going to, again, echo with this amazing, great panel and what they're saying. But I want to kind of give a couple of the practical things that you can think about then. So it is Very true. That like even in my practice, like first of all, like anybody who's an ortho, they're an automatic 3 months recall. Like, I mean, I'm telling my parents, like, you're spending thousands of dollars. These kids cannot clean their teeth and cannot maintain oral health. Spend that extra, whatever cleaning fee and bring them in a little quicker, sooner, so we can actually maintain things better. Works great. And everybody knows that it's almost like immediate thing. I have some patients who are on like a month or 2 months recall because they just bill faster. We talk about that insurance is not something that's going to dictate their health and how they're going to be determining their treatment for. This is how their biohealth is and this is their biochemistry. You're building faster. We're going to have to clean that for you, kind of thing. So it's more of an education. I think I saw some of the comment coming up. It's more about educating patients and communicating with patients. That's going to be important. So you're absolutely right. Now we're at a point where patients are calling. It's like, I need to be at, month recall, 3 months recall, and you're telling me that I can't come in. How is it not an emergency? Obviously, the emergency was determined by ADA, and then it's a guideline that we're following at this point. But what we're doing actually is my team actually is creating little blips of even like an iPhone videos or something like that. My hygienists are actually doing that. They have each topic that they want to talk about. This is how you actually brush your teeth. Do you see the toothbrush? It's actually doing this number. You're not supposed to brush this way, and that you need a new toothbrush every time you're doing this, X, Y, and Z. This is how you floss. And, every time you come in, you're complaining about how I'm poking your gum. Let me tell you what that numbers mean and then what it means to relating to the periodontal disease. So my hygienists are actually doing this because they're actually pushing this out on a Facebook and we're posting on our website. So it's a communication. You're staying constant communication with your patients and you let them know what's going on. We're also giving them updates on what we're doing. Hey, we're getting this surgical clean air. This is what it is. This is the website. Go check it out. This is for you and then for us as well too. Or some of the things that you're doing. And these are the PPE things we're doing. And then we're also having to kind of figure out how to get these patients check in and check out better, especially when we get back. So we're having a new protocol that we're going to work on, and that's going to be communicated with patients so they know. We're telling them about teledentistry. So like all these little bits and pieces I think we can do, and that's kind of staying in communication with patients. And then also for your team to be on top of it and also get involved as well too. They actually really love it because they're actually communicating with patients in that way as well too. Something to do because they're all sitting around doing nothing at home, enough cleaning, enough cooking. Like we want to do something different as well too. So everything that Heath is saying, I'm echoing completely 100%, but I don't want that education part of the patient to be at pause because we're in pandemic, because we're social distancing or because we're quarantined. I want them to understand, especially nowadays where we have means of being able to communicate with our patients this way, why not utilize that? So I think it's something that as you are being a leader of your team, empower your team members to be able to do these type of projects and then also kind of provide the means to be able to communicate with your patients as well too. And then they're going to be ready. So when they're ready to come in, it's not like, oh, we never heard that. They've seen it. And then so they know what needs to be done and how it needs to be done.
Yeah, this is such an amazing time to be practicing dentistry that we have technology and all of us are, emphasis on technology within our practices. But our ability to communicate effectively and efficiently with patients has never been easier. With whatever source used, whether it's Weave, Revenue Well, Solution Reach, any of those systems, it makes it so easy to do that. And, Heath, you brought up a really good point of, all of these patients that we've been hammering, it's so important to do X, Y, and Z, or you need to get that crown done because X, Y, and Z is going to happen. One of the approaches that, and maybe I'm a little bit old school, but, like Yusan said, my team has time on their hands right now, right? So when I have a team member rotating through my office, rather than just canceling, the next week's appointments and doing all that, it gives us an opportunity to get on the old school phone and call a patient and just say, hey, Mrs. Jones, you were supposed to come in for your perio maintenance. We are not going to have you come in due to this pandemic. That does not mean that this isn't something we're concerned about, but these are the things we're going to do to ensure that we can best take care of you in the future. Or Mr. Smith or Bob or whoever, your crown, we understand there's a crack. This isn't technically an emergency. We hope it doesn't turn into that, but we are actively monitoring. And what that tells the patient with that 10, 15-second phone call is all it's telling is you care about them. And that, I think, is a very easy and effective way for us not to lose the emphasis on the importance of their oral health in this time. And whether that's done through a text, I love the video idea of like making a little video, or even like I said, I have a small enough practice that I can still have my team get on a phone call and just say, hey, we're calling to cancel your appointment, but this is what we're doing in our office. This is what, we'll be in touch. Look for our emails, website or web blast or whatever it might be. But we need to allow technology to work for us, but don't forget about that personal connection of just talking to somebody, especially this day and age when we don't get to see people and we get blasted with so many damn emails. Sometimes it's nice just to have a phone call. And I think it's a really easy way for us as Solea users to set ourselves way apart of our colleagues and ensure that when we come out of this, we're going to be hitting the ground running hard.
Yeah, but Tim, we've been using this time to really communicate, both in person. So, all the appointments that we've changed, we've done it in person on the phone with them. It's a great time to catch people at home right now.
Yep.
And they want to talk. My team is telling me that they cannot get off the phone because everybody wants to talk.
But we are also sending out at least weekly communications on what the status is, what we know, letting people know that we're there for them, letting them know how to reach out to us. I want us to be the kind of the experts, if you will, in the field. And I want people to know that we were there and proactive. So we're being very clear about the precautions that we're taking during this pandemic and what that, hey, we're doing what we've always done, but we have stepped up some things, and this is what we're doing differently. This is why we're doing it differently. I don't want people to sit and wonder and worry. I want them to know that we are proactively dealing with things. And I think that that's always our best approach, is to deal with it before it's even a concern in their mind.
Yeah. Great point, man. So let's get to the last question here. Most of us are Solea users. The poll kind of established that. Before I forget, I do want to launch a couple other polls just real quickly because I'm very curious. When will we return back to work? Ooh. On a normal basis, quote unquote normal, even if the new normal is different?
I think this is one of those questions that I get asked by everybody, like every day, like whether it's any profession, when are you guys gonna think you're gonna be back? So it's interesting to see how it's evolved over the span of the last month anyway.
Right.
Probably the wrong one, because I never would have predicted that we've been closed more than 2 weeks. So
shows how much you know, Dr. Kelly.
Exactly.
As soon as you think you got this all figured out.
Yeah, one thing I've done for my team, which I don't think it's the actual date, we have actually set a date kind of as mid-May as our potential return date. It's a soft date that we only know in our leadership team, that we kind of work toward things. There are certain projects that we want to get done by then.
Yeah.
I don't think it's going to be till June, honestly. Well, there you go. So
there you go. 50% disagree.
Yeah, I agree with that.
For the record, my prediction was June 1, back when this was getting going. So
come on, Tim, you did not.
I did. You can ask my team and ask my wife. I said June 1 before we're back to rolling. But the way things progress, who knows? But and one of the things that I found interesting is that when I've seen a lot of offices like give hard dates, like the ADA said we're going to be 2 weeks. So they're like, we are sending all our patients, like, we are reopening on this date. And then it's like that date comes by and they're like, we are reopening on this date. And so we've kind of really taken it back to keep that open communication with our patients, but we have not been like, we are taking a date.
Like a hard line approach.
Yeah. But I like how you said it's important to have that future planning with your team and your leadership to be like, hey, this is what we're anticipating. These are these, issues that we're going to see coming up, and how do we adapt that as this continues to progress and evolve?
Right.
And one thing you want to do is actually think about how that schedule is going to look like. So we have established something called a priority list. So it's sort of like, if you've been really good about paying your bills and showing up to appointments, and we know that you're trustworthy, because we're going to have limited times that we can see some of these patients as well too. Last thing I want is open and then have patients no show for that appointment. So we're actually giving the preferential treatment in a way. Obviously the emergencies come first as well too, but they're getting rewarded for the good faith that they've shown up to this point. So we actually are crafting schedule in a way that we can make sure, especially for hygiene appointments and whatnot, we're making sure that we're giving the time slots and points of things, patients who actually need scaling replanning or the perio maintenance, and then those who show up on time and those who are going to be there, they actually get to be crafted into the schedule first in a way. So you can actually control your schedule of where it's going to be, not just like putting everybody in and see what happens, because we got limited PPEs in some ways. We need to make sure that we're utilizing for the best, and we're doing best thing for the patient as well too, and then kind of getting them back on track with stuff. So we're actually thinking about how to make that schedule be efficient and productive, and also work for us as well too.
Hey Heath, can you ask that question that was just asked? Can you announce that one? Because I think it's a good one that ties into this about the planning.
Say that one more time.
That last question, are you planning on opening?
You want to ask my question again, or the question from the Q&A?
From the Q&A, because I think it ties into that really well.
It says,
Can you ask it? Because I don't know what question you're talking about.
Oh,
is it Gonlick? Yeah, the Gonlick pediatric dentist. Are you planning on opening your offices with extended hours and time to accommodate patients? I think that's an awesome question, because
my answer is absolutely. I feel like we just had 8+ weeks of time off. We need to work extra in order to accommodate. So, yeah. And then I think the patients also are going to be having different times. They're going to have to go back to work. We need to accommodate their hours and their schedule as well too. My team already knows that we're going to be working extra.
Absolutely.
Period.
So I did a startup 5 years ago, and one of the things that I realized was important is that I came into our community and I opened Saturdays. I was open every other Saturday, and it was specifically to accommodate people's schedules. So Yusan, just like you said, people are going to get back and they're going to be back to work finally. They are not going to want to take PTO or any vacation if they have it to go to the dentist. So I think extended hours, potentially a Saturday here and there, is an unbelievable way to increase your production and some of the revenue within your practice, but also to meet the needs of your community. I think it really says something about your willingness to take care of people, because this is not going to be easy for them when they get back, or for you. But we have the flexibility where we can do that. And I'm pretty sure our teams will be okay with it, jumping back into it. So I can speak from firsthand knowledge that those extended hours and Saturdays, stuff like that, had a huge impact on my community. And part of the reason why I'm at where I'm at right now. That's why I like that question.
Tim, that was perfectly answered, and I couldn't have said it better myself. So great job.
So I was camping out in the answered questions section, so I didn't see the open question. My bad. So the last question here, how can Solea users prepare now, like us specifically, our tight group of people? Solea is a relatively niche group of people, most of you would agree. And how can we be ready to hit the ground running, whether it's May, June, July, whatever? What do we need to be doing now to be prepared for the best case scenario when we start again?
I'm going to start because I can, and you are going to go to me anyway, right? Yeah. I'm going to keep this really short. I think we need to do more of stuff like this. Like, to be honest, I really think this community of Q&A, I mean, this was one of the more fun, Zoom things I've been on, because it's nice to be around like-minded people that have a positive outlook and to get different people's perspectives on things. So I think moving forward, I want to do more of this kind of stuff within the community of dentists to help us all get to that end goal. Because that's ultimately, we're all trying to achieve the same thing. We're all dealing with the same issue. So how do we, together as a community, move forward? And that's why I'm really happy, Heath, that you put this together. So that is my short answer, under a minute.
Nice job.
Solid.
Yes.
So I'm distracted by a great comment in here by Daniel Knau saying, that he foresees a large influx of semi-emergencies, if you will, then kind of a decline before returning to normal? And do we see the economics of patients that lost funds? So, there's many businesses that have been affected. A lot of people have been affected, be it the stock market with our retirees, be it, other people that maybe finances aren't going to be there. And I did a great webinar on this Spear Education Forum last week on kind of phasing treatment, and thinking about how do we. One of the great phrases I learned years ago is, I'll wait with you. So I want patients to know that we're ready when they're ready. We've never been one of those high pressure cell offices that they have to do it today. But I do want people to move forward towards oral health, and always have wanted that. So we try and make it easy. And if there are reasonable stepping stones for them to move forward, we try and do that. So I think it is something that we're going to need to look at. Well, where does that fit within each of our practices, and how do we help patients move towards oral health, despite the fact that finances might be a little difficult for a little while.
Mm-hmm. Real quick, Dr. Yusan, we had a question because we are in bonus time right now, so I don't want to run out of time and not answer this. How many of you guys basically are accepting insurance plans, and is this an opportunity to leave those plans?
I do participate with a lot of PPO plans. I have a little bit of a different view on insurances than some of the other people. Consider insurance as necessary evil, but at the same time, I also do consider it as a benefit, which is what I educate my patients on. It doesn't insure you anything. We all know that. But I don't ever have patients determine their treatment based on insurance. We always talk about this is what you have to, that this is what you need, and this is what needs to be done. You have a benefit that can help you with this to kind of start the process. I have a lot of patients who go above and beyond. And then a lot of times there's kind of whole pre-D issues. I usually ask the questions. I'm like, are you not going to do it because insurance is not going to pay for this? This is something that needs to be done. They're like, well, we have to do it anyway. I'm like, yeah, then let's do it. I mean, this is the estimate that we understand, and then this is how we're going to do it. So we always utilize insurance as the means of being able to help patients to be able to get the treatment that they need. So I don't necessarily, I mean, because dentistry are expensive. I understand, like our parts is expensive as well too, but I want the patients to be able to have that access and be able to afford the treatments that they need to get treated for. And I think it's also, in a way, good marketing for you as well too, because patients do kind of start to find dentists who participate with insurance, and that's how they start. And then they ended up expanding from things that you're doing that's above and beyond what insurances will pay for, and not having to worry about that as well too. I think, as a Solea dentist, we actually can position ourselves really well, especially as we're going forward, because we can do that same day dentistry and so much of that multi-quad dentistries, and then being able to incorporate a lot of the procedures together at the same time. I kind of see that as such a great advantage for us being able to utilize Solea to do that. I think I saw one of the comment coming up using Solea. We can probably reduce the amount of PPEs that we need because we can do more dentistry in one given setting rather than having multiple visits of these patients coming back. I mean, how great of an advantage do we have there? Not only because of that aspect of it, but also because of the efficiency that you're going to be having, and not having to worry about overturning the chairs and new regulations and all those different things. So just as simple as that, I want you to kind of think that way, and then also kind of broaden your perspective from that point as well too.
Right. So going off of that, like Dr. Kim mentioned, like a lot of Solea dentists, which is who we're talking to tonight, they've kind of experienced this, fortunately, years in advance, right? Like we kind of understood what it was to understand chair time versus doctor time. What I mean by that is if you're really worried about aerosols, let's say, and you can keep a patient in your chair breathing oxygen for 40 minutes versus 12 minutes for, like, let's say a class 2 filling, that's a big deal, right? So why would you keep someone in the infection risk that it is taking up a chair, breathing the air in the operatory for 40 minutes when something could take 12? You see what I'm saying? So like that goes into the whole, Solea is more than just the efficiency, but it's also the infection control piece. the fewer minutes that people spend in your office because you're more efficient, the better it is for everybody, right? Because we don't like people just sitting in our chair for no reason. Like, we would like them to be in for a reason, which is to do their work and then leave when they're done, not have a whole lot of downtime in between. And that's where some of this infection control stuff, I'm convinced, is going to go, because the longer you spend in contact with these people, for instance, one of our protocols in our offices that an assistant is assigned to every room. So they spend the entire time with that patient the whole time. So they're in contact with them for 10 minutes or an hour or 2 hours or 4 hours, depending on how long the procedure goes, right? Well, that's technically more risk if you think about it. And so something we should be thinking about, like you said, Dr. Kim, you just made me think about it, was the efficiency of getting a patient in and out without, like, with minimal casualties, so to speak. But let me real quickly, we probably should start to close. I don't know, maybe we'll do like one last round of any closing remarks people have, because we are definitely in the bonus time at this point.
We should just call this Tim time.
This is 10 time. This is this extra 10 time
Tim
because he
overtime.
took too much time earlier on. Tim, why don't you go again?
Okay. No, I think with this, you guys, it's crazy. Like, we're talking on our computers or phones or whatever it is, and people listening, watching this, and I hope everybody can sense the energy that this community brings. This is not a doom and gloom, we're going down. This is, how do we come out of this together stronger, better, more efficient, more effective? How do we take our practice to that next level, like we've already done by investing in Solea? And I think this type of community is what highlights why this technology is so successful, because we all grow together, we learn from each other, and we struggle together. And I wish we had 3 hours to sit here and talk about stuff, because I know we could, and hopefully we can do something like this again in the future, because I think there is enough of a community that wants to hear, you guys are scratching the surface on this efficiency within your chair and how we can do, I mean, that's a whole night's topic in itself. So I just want to thank Keith and all the panelists here for getting together tonight, because it shows that we're here not because we're paid to be here. We're here because we enjoy this community, and we enjoy sharing our story, and we enjoy learning from people's questions and what's going on in other parts of the country. So thanks for having me and all of us, and I look forward to doing this again. Time.
Nice job. So, Heath, I'm very appreciative that you reached out. It's a great opportunity to spend time with some great friends from across the country. This is a difficult time. It's a scary time for a lot of people, for both our patients, our teams, and Tim, as you said, as a business owner, there's some uncertain times. But like you said so well, though, you can only focus on what you can control. And I think it's time to spend time educating, to learn new things, learn new techniques. I'm doing a ton of webinars. I've got time that I didn't have. So might as well learn and grow and perfect. We had a team day where our team came in at the very beginning of this, and we literally cleaned everything out of our office. We took everything out of every cabinet in the entire office. We cleaned out everything, wiped out everything, organized, labeled, and it was so therapeutic for all of us to spend that time together. My team has also been on education sites, so they're learning and growing during this time. I really want to prepare myself to hit the ground running as soon as we're able to open back up. And again, we just need to focus on being the leaders that we already are to improve that and to move forward. So just thankful for this opportunity and thankful, for all of you for being here.
I again will echo everybody, and I want to thank the opportunity for me to be able to have this time with everyone, because it's really refreshing, and it's really amazing to be together and sharing ideas and be able to share what we have with like-minded people. As Dr. Kelly said and Tim said, I always enjoy learning new things from other people as well too, because that's what helps me to grow. I feel like our world is always so small. We're like right here every day, and that's kind of what we work with within the four walls of our offices. So when we actually have the time to expand ourselves out like this and be able to touch and communicate with people, I think this is amazing. There's so many ideas that's out there, and I second what Dr. Kelly is saying, that as a leader, you want to be above where everything is, be able to really absorb and then see what's going on, take advantage of everything that's out there. I mean, even like as crazy as with this $2 trillion packet that's coming out, with the craziness of EIDL and PPP that's ever changing every hour thing, well, that's your responsibility to know this thing and be able to lead things. Take advantage of it, learn about things, and go with that. And I certainly second with the idea of being able to have this opportunity and time to be able to learn and grow as well too. So this is amazing, actually, to be able to share all that and be able to spend time with the people that are just unbelievably amazing. So that's awesome. Thank you, Pete.
Yeah, you're welcome, guys. I mean, I love the energy, as Dr. Anderson mentioned. Like, I do want to draw attention to, the problem we had in February was we didn't have enough time, right? We were so busy. There was just, we were spinning our wheels, like life was busy, right? Everything was great. It was business as usual. But now our problem switched. It's like we got too much time. So my challenge for you guys is to utilize it. We have this time as kind of a gift in a way, that we should be sharpening ourselves and the people, and maybe really using the relationships we have that we have, maybe abandoned in the past, but like sharpen yourselves mentally. I'm most worried that our colleagues are going to burn out during this time, that we're going to get so tired of sitting around and just getting very restless. And so my warning, is just don't do that. Like, engage in webinar and engage in community, engage the best way you can, given the restrictions. I get all that. And really just like game plan your way. We talked about that today. Like I heard many of you already say, like, you basically cleaned out your offices. You got things in order that you never had time to do in the past because you had a busy schedule. And so I do think we will come out of this better. We will definitely come out of this leaner and meaner. And so I thank you guys for joining us tonight. I've had some requests to do this again. We will probably do that. I'll reach out to everybody and try to get that on the schedule. But it's not a bad idea to do this kind of routinely, even after everything gets back to normal. Because I know I'm going through withdrawal as far as not going to user group this year. Like, I'm really, really upset about that because I miss my people that I get to see basically once a year. But maybe I can see them on a webinar and that'll make it better. So again, thank you guys for coming. We have courses coming up. I just want to let you know they're all free right now. LearnMoreDental.com. Dr. Yusan Kim herself will be talking about putting yourself into turbo boost when you are ready to enter your practice again. And there's all kinds of other free things. Today we did a foam rolling class, for instance. So that's helpful because we got time to foam roll and take care of our backs. Like, again, check us out. Sign up. It's all free right now. We're just trying to come out of this stronger.
Awesome. Thank you.
You're welcome. All right, guys. Well, I'm going to go ahead and end this call, and I'll be in touch with you if you want to do it again. Okay? No pressure.
Thanks, Keith. Heath. It's great to see you.
See ya.